ना कोई marketing, ना कोई शोर शराबा, बस solid numbers. This Indian brand quietly generated 60 crore plus in revenue this year, built entirely through a strong network of clinic doctors, and most people didn't even notice. This is the story of Aakaar Medical Technologies, a company that's redefining skincare, haircare, and injectables by becoming one of India's most trusted B2B brands in the aesthetic space. So today I'm thrilled to be joined by a visionary who has redefined the cosmetics and aesthetic dermatology industry in India, Mr. Dilip Meswani, the promoter and managing director of Aakaar Medical Technologies, which is also coming up with an IPO. So let's deep dive into the story behind the brand, the business, and the man who started it all. To begin with, could you explain in simple terms what exactly does Aakaar Medical Technologies do? How did you enter the industry and how has the journey been so far?
Okay, so Aakaar Medical Technology, we are in a very, very different niche business of making people beautiful and younger. Through our doctors, the qualified dermatologist, and it's a very niche industry which has started very, very young industry, I would say, it's 25 years ago. Let me tell you more about my background. I am a biomedical engineer and started my journey as a service engineer, servicing medical equipments, and then I ventured into business in '99. I worked with a very renowned US company for a few years, and that was the beginning of aesthetic industry. So I brought in first laser hair removal in India, and I have got a lot of first in India. We brought pigmentation lasers, tattoo removal lasers, hair removal lasers, blue light for acne, holmium laser for stones, kidney stones and prostate. So I have brought so many technologies in India, and I would say the aesthetic industry started in '99 with me. So it's been quite a good journey, very long journey, but it's been very, very exciting, and I enjoyed this work. Okay, so first hair removal laser came in India, and that is where the skin doctor, the dermatologists were never exposed to this kind of technologies. They never learned all this. So we had a very tough task of teaching them, telling them what it is and how it works. Our skin is different and it needs a special protocol which is different to a whiter skin, like American and European skin. So we had to devise protocols for our skin, and we were successful, and we could train the dermatologist on how to use, and slowly the industry picked up, started with hair removal, pigmentation, skin tightening, and so many other technologies which has come. So it's been a long journey and an interesting journey. Here we are after 26 years and sitting with you.
Got it. So sir, आपके clients कौन-कौन हैं? Do you directly sell to customers or it's a B2B model?
Okay, हमारे clients जो है doctors है, mainly dermatologists and plastic surgeons, जिसके through ये सारे सर्विसेज और ट्रीटमेंट्स प्रोवाइड किए जाते हैं. तो हमारे पास प्रोफेशनल प्रोडक्ट्स हैं एंड होम केयर प्रोडक्ट्स है, जैसे ये सारे प्रोडक्ट्स हैं, जे आर आकार प्रोडक्ट्स. सो ये सारे प्रोडक्ट्स डॉक्टर के थ्रू प्रोवाइड किए जाते हैं. डॉक्टर्स ट्रीटमेंट करते हैं मशीन्स के साथ, एंड देन दे प्रिस्क्राइब प्रोडक्ट्स एज पर द स्किन ऑफ द पेशेंट.
Got it. So is there any particular reason why you chose to go ahead with the B2B model instead of directly selling to the customers?
Yes, we had some very interesting journey. So my business started selling devices, and I was known in India that दिलीप के पास अगर कोई device है तो अच्छा ही होगा, and we did very well. During the journey I realized that device business is good, very exciting business, but then पता लगा कि there is a gap. There is a gap of good products, and there is a gap of good Indian products also. So we started working on it, and I was joined by Dr. Rahul, who is our CEO. He joined us 10 years ago, and we decided that we will do something where we create a value for our company. So we decided working on our own brand of products, and also international brands of products.
Okay. Um, and you mentioned that you sell products which are under your brand, and then you have international ones also. So, how do you manage this mix, and where is your focus on?
Right. I've been selling a lot of international products, mainly for professional care as well as home care. And we are very careful in selecting those products because our skin, which is a different skin than a Caucasian or a white skin, American or European skin. So we need to be very selective, and I've been working since many companies from Europe and Korea for these products, where we select these products in consultation with our dermatologist, and our products we formulate. There is a process which we follow for formulating these products and getting it manufactured under our brand.
Sir, your operations are very smooth, right, from sourcing to delivery. Can you walk us through the backend process?
Okay, start with in-licensed products which we import from Europe and Korea. So we are working with few of these companies since more than 15 years, and we basically import. So the process is we need to register this product with Indian FDA, which is known as a CDSCO. Register them, bring them to India, and sell them. So now identifying these products, the in-licensed product, which are imported products, we try to do a lot of research. We attend a lot of international conferences, and also we know so many other doctors internationally who recommend that these products are suitable for your kind of skin. We bring samples, we do few analyses with our KOLs, key opinion leaders, and they recommend that okay, some of these products are suitable for our skin, and we start the licensing process, registration process, and bring it to India. Similarly, for Aakaar products, we also formulate with our manufacturing partners who have got a very good, excellent R&D. So when we attend the international conference, we try to source right products, right formulas, which is a gap in India. For example, there are a lot of sunscreens available in India and also abroad. Some of them are suitable for us, some of them are not suitable for us. Like one of these sunscreen, which is latex sunscreen, which we have formulated and it's been very popular among dermatologists. So and also so many other products which we have formulated in India.
Understood. So do you plan to, sort of increase your own brands for, better control and better margins?
Uh, all right. So this is very tricky. Okay. No, the focus is how do we increase our market? What is the need of a market, and where do we stand, and what are the gaps in the market? So we try to balance between in-licensed product and our products. Certainly we want to have more of our products, but then for in-licensing products also we try and select the right products and which have a right pricing. In licensing product has one issue, which is which they are expensive, very expensive. Okay, whatever reason they are, but Indian products, when we formulate, we make sure that they are of the international standards. They work very well on our skin without any side effects, and also they give results. So we work with our key opinion leader, dermatologist, and test them, evaluate them, change the formulation if necessary, stabilize them, see the safety of it, and bring them with a affordable price for India, which is very, very important. We need to be affordable in India and select the right product which is suitable for our skin.
Got it. And so you conduct a lot of training and workshops for doctors in and for the clinics. So how has that helped in building healthy relationships and in repeat business as well?
Right. This business is a very special business. Reason being that lot of new technologies, new treatments come. Every 3 to 6 months there is something new. So what we do is we catch the dermatologists when they are in the colleges. We catch them early. Now what do? We give them a lot of trainings for injectables or for treatments, for devices. Like we have got a lot of laser devices which are very unique and which gives amazing results. Now in combination with this kind of products, they give the best results, which is suitable for our Indian skin. So we catch them early, we train them, we handhold them and help them to start their practice, to make this practice as a business, because ultimately this is a business, right? So there is a lot of scope, and every year hundreds of dermatologists are coming out of college. Before they come out of college, we train them. We have a lot of senior doctors, dermatologists who are our trainers and who help them train this young generation who is inclined to develop this practice in a very big way. This market is going to grow very well. This market has just started, and post-corona it is begun. Social media has helped us a lot, and it is just a beginning. Like, you must be using some of the products, or so many things you must be knowing or seeing on Instagrams.
Right.
And this is driving the business. This is driving young dermatologists who are into colleges to get into these practices.
Got it. Understood. So whenever you are, launching a new product, what is the level of extent, to which you take the inputs from doctors, and how does it help you, and what is the process like? If you could just take us through it.
All right. So we study a lot of supply and demand gap in the market. Now there are few international products which are popular internationally as well as in India, and we see that they are available in India. They are suitable for Indian skin, but again they are too expensive.
Right.
We want to go do something for masses, where everybody can use it. There are more than 20,000 doctors, dermatologists in the market, and still very few of them practice this.
Okay.
Everybody has aspiration, the new and the senior doctors, and they want to offer these products or these services to their customers who are patients. They need affordable products, and this is
Right.
where Aakaar comes in. We make it affordable in compared to our in-license internationally manufactured products. Saying that there are certain international formulations which cannot be manufactured in India. Like we are representing one Spanish company, and one of their peel is so popular. It is one of the best peel in the market, and it cannot be replaced or manufactured in India. So we continue work with our international partners.
Okay.
And we bring the best to them. Now coming to the question of how much our doctor help in formulation, a lot. Whenever we think of a new formulation, we approach few of them.
Okay.
We consult them, we ask them whether this kind of formulations are needed, what is the gap, and what needs to be done. We work on a formulation, we make few of the samples, give them, tell them to give us a feedback on their patients, and once the feedback comes, we take them, make it commercially available. Of course, keep in mind the quality and the safety for the patients.
Got it. So what does your distribution channel look like? Is it directly through sales reps or through any channel partners?
Right. Our distribution channel is mainly through our salespeople.
Okay.
So to say that our salespeople, we have more than 170 people working in our organization, and out of that 140 of them are salespeople spread across 75 cities, all India, tier 1 and tier 2 cities.
Okay.
So they meet doctors, and they are meeting huge number of doctors, almost 8,000 to 9,000 doctors month on month. And now coming to the distribution, so once a doctor needs a product, they place an order, and we work through an arrangement called CSA. So there are very good logistic partners available in India, and we work with one of them as a CSA arrangement. So they have depots all over India. So whenever a doctor needs a product, within 24 hours it is supplied to them.
Okay.
So logistic being a very important part of this business, so we work with a CSO who has excellent logistic arrangements.
Got it. So since you mentioned that you are spread across Pan India in different cities, which city have you seen maximum sales in?
You'll be surprised. All cities are doing extremely well.
Okay.
All tier 1 cities. Tier 2 cities have started doing amazingly.
Okay.
They have grown so well and they are growing so well. There is an aspiration for these patients in tier 2 city to go for such treatments.
Understood.
And social media has driven this business so much,
Further.
inspired these patients to go for such treatments. So tier 2 cities have started doing. So across India, since we are spread all over India, other than East India, yes, we are doing extremely well. But lately we have seen that even East India and the Northeast India have picked up well.
Okay. So your revenue went from 19 crores to 61 crores just in 3 years. So what is the growth story behind this?
Interesting. So Corona was the biggest challenge for us. We were doing very well till 1920, and Corona came and suddenly breaks up light. Nobody was going out.
Right.
Nobody needed a treatment.
Right.
So that was a turning point for us. But we decided that gave us a time to look into what we were doing and what we should do to grow. And we formulated a strategy, and then we started certain projects and certain activities, which these activities have really helped us a lot. Okay, so we knew where we wanted to go and what we wanted to do. So second year of Corona, from 11 crore we went to 19 crore. We built up a team, a strong team, and this is the backbone of our business, a team which is important for us, for every company. And we build up a strong team, dedicated team, motivated team. We launched a lot of our own products. We focused on certain in-licensed product in a bigger way, in a better way. We invested a lot into team and marketing. This was also supported by a social media surge which happened. So both coupled together, our efforts, strategy on team building, marketing, a lot of workshops and training also helped us. So we went from 19 CR in first year of Corona, second year of Corona, to 32 CR, then 47 CR, and here we are. Last year we closed around 61 CR.
Okay. That's amazing. And now that you're gearing up for an IPO, could you tell us about what is the IPO size and in which business areas do you plan to, utilize the proceeds for?
Okay, so IPO has been a very good journey for me and for my team. Lot of learning, lot of compliances, and lot of different way of thinking. When we thought of our IPO, we thought, yeah, IPO कर लेंगे, पैसे मिलेंगे ना. बट जब प्रोसेस में आए, जब compliances फॉलो करने लगे, और लास्ट 1 month when we started meeting investors, we had a vision of reaching around 500 CR, but अभी जो लग रहा है कि हमें 1000 CR तो आराम से पहुंच जाएंगे. We are looking at a market cap of 5 to 6,000 CR in next 5 to 7 years, or even early.
Okay.
We have got a lot of investors who have given suggestions. Now coming to IPO proceeds, we are going to utilize this definitely for working capital, but a working capital we want to invest into our marketing, development of new products, development of team, because team and new products and the existing products, we are going to give us a growth, exponential growth, which we are looking at. Size of the issue is around 27 CR, and the valuation post IPO will be 102 CR.
Amazing. So your gross margins are looking stronger. Is it because of product sourcing or pricing or something else?
Being Gujarati, I always believe that we have to be profitable. I don't believe in negative balance sheet जो अभी currently सारे startups कर रहे हैं. So right from beginning of my business, I have always been profitable, and this is what my focus has been, that okay, business करेंगे तो नफ़ा तो करना ही है. Okay. So जब strategies बनाई, marketing plans बनाए, एक चीज़ तो हमने ख्याल रखी थी कि we will invest but we will also remain profitable. So we have always worked with a product range and device range जो profitable हो. Uh, Earlier, we were focused on device business and less of product range. Recently, we have focused on product range and less of device range. But again, we are changing the device range portfolio from selling a device to a recurring revenue of a device from a device, which is going to give us a lot of help in margin, increasing margin, and our own products have helped in increasing the gross margins.
Sir, you're also looking at new specialities like gynecologists and maxillofacial surgeons. So, are you also looking to launch any new special division, and are you planning to develop specific products for them?
Yes, we have. We are working with this specialty, and we are looking at adding few more products for them. Also, we have added one very big specialty into dermatology segment, which is psoriasis. We have launched a very unique drug. As we are known to launch unique products, we have launched these unique products manufactured and invented in India. We are looking at expanding that segment and as well as other specialty.
And you mentioned that you get your products manufactured through a third party. Could you walk us through the process?
Right. Third party manufacturing is very popular in India, and we have the most US FDA plants in the world in India who are manufacturing very complicated medicines and very specific medicines. So instead of going into manufacturing, we work with the best of the manufacturers who have expertise, who have good R&Ds. So we work with them in formulations, we work with them in testing and evaluating our final products. So we work on a loan license basis where we loan the facility and all the products are manufactured under our name, Aakaar name, as well as our brand. Very important thing about this third party manufacturing is that we try to focus on our brands like Swaida or Ethrelum or Lytec. It's important that brand becomes bigger than the formulations. So under Swaida we have several formulations, under Ethrelum we have several formulations, Lytec we have several formulations, and these brands have become popular, like Ethrelum, which is a very new brand, 1.5 year, and we have achieved more than 5 crores, which is first time in our company we could a single brand could achieve such a big numbers. So we are very excited to have our own branding, which will help us in taking us forward.
So, sir, one last question. What is the long-term vision that you have for Aakaar Medical Technologies?
Aakaar has always been first in the industry, and we are looking at making ourselves bigger and better with our patrons who are our doctors, dermatologists and plastic surgeons, to do something which nobody has done it, and we are looking at something very new, very big in forward integrating our business.
Got it. Thank you so much, Mr. Meswani, for this insightful and incredibly honest conversation.
Thank you, Hiral.
Aakaar is clearly more than just a business. It's a well-engineered ecosystem that's redefining how aesthetic care reaches professionals across India. If you enjoyed this video, please share it. And for more IPO deep dives and behind-the-scene founder journeys, stay tuned.